Hi everyone, this is Dr. Kafeel from BRD Medical College, Gorakhpur. Today we'll talk about Nipah virus, how you you get the disease and what are the preventive measures. But first of all, I tell you, don't get panic, stay calm. Listen higher authorities and follow the instruction. I assure you, follow the preventive measures, you won't get the disease. Best part is, unlike encephalitis, which is epidemic in Gorakhpur, which spreads in from July to November, it is spread from December to May, and May is going to over. So don't panic. What is Nipah virus? Nipah virus is a RNA virus which resides in the bat's body, and bats ejected this virus through urine, stool, and through saliva. So whenever this bat tries to eat any fruit, it injects its saliva into the fruit, or when it tastes the toddy, so it injects the saliva into the toddy. So whenever any animal eats the half-bitten fruits, get the infection. How it comes to the human being? When these human being in the direct contact with the animal who is already infected with the Nipah virus, or human being eats half-bitten fruits, drink toddy infected with the virus, or it comes in direct contact with the person already infected with the disease, Nipah virus disease. When the person who's already got the disease sneeze, the virus goes. So 1 meter distance you should maintain. This is the mode of spread. So what are the signs and symptoms of the disease? How you know the person is going to get the disease? The disease started with the common flu-like symptoms like fever, headache, cough, cold, sneezing, nasal discharge. You will think that is just a common cold, but no, it is progress very fast. Next day, the person will have disorientation, breathing difficulty, unconsciousness, and leads into death. So what are the preventive measures and what are the treatment modality? I'll tell you about this virus. Very, very contagious, 90%, very progressive. Within for 24 to 48 hours, the person can go into coma, and very high mortality, that is more than 70%. Treatment part is you give the symptomatic, there is no specific treatment. For fever you get paracetamol, IV paracetamol you can use. For seizures you give anti-epileptic drugs. For encephalitis you give anti-edema measures, proper position, and for breathing difficulty you use ventilator. For myocarditis use Lasix or anti-failure measures. So these are the part. New drugs they're talking about: ribavirin, chloroquine, anti-malarial drug, and monoclonal antibodies. They all are in the initial state and they're going in the trial, but they're not very beneficial in the disease control itself. So we have to depend upon the symptomatic treatment itself. That's why I always say that prevention is the main best weapon. How to prevent this? Avoid contact with the bat, pigs, and any person who's already got the disease. Wash all the fruits properly. Maintain personal hygiene and avoid eating half-bitten fruits. For the medical profession personnels, those who are treating the patients, they should wear gloves, they should wear masks, they should wear goggles, they should wear cap, they should wear gown, they should use hand sanitizers. So washing hand again and again is the best prevention